As a clinician, I normally see a lot of patients in my clinic that have care partner relationship issue. And sometimes those issues are very difficult, to address, at the clinic. And I think this will be a very big opportunity, to provide information and resources to care partners and persons with MS on how to manage relationship between the care partner and also the person with MS. Next slide. So we know that MS is extremely changeable and unpredictable. MS can, result in difficulty with everyday task and family schedule. But as someone with MS and also their care partner, they have to be very careful to make sure that they are cognizant of household tasks like cleaning, shopping, cooking, and childcare. MS can cause tremendous issue in these roles. Also, MS can also affect, care-related tasks like dressing, bathing, taking medication, and also transportation. Also, daily activities also can be affected also by MS and also can make it unpredictable. Daily activities such as work, entertainment, exercise, and hobbies. So it's very, very important that both the person with MS and their care partner are on both the receiving and giving end of responsibilities. And also because at the clinic, I normally see some of my patients, and also they feel as if because they have MS, they don't have any responsibilities. And I always try to emphasize and let them know that even though they do have MS, that they still also have some responsibilities also to their care partner, just as much as the care partner also have responsibility to them. So just because someone has MS doesn't mean they cease to have responsibilities. So both the care partner and the person with MS both have responsibilities to each other. And that is one very important point I want us to take from this presentation. Next slide. How about intimacy? And this is one of the difficult issues to address also at my clinic. Because persons with MS, they do have fatigue, they do have spasticity, some do have incontinence. And all this can interfere with sexual activity and sexual relationship. But we as clinicians, or I as a clinician, I can prescribe medication for fatigue. We can put someone on modafinil for fatigue. We can put someone on baclofen for spasticity. We can try to manage incontinence. But sometimes these medications or the physical therapies, occupational therapies may not be enough. It is the responsibility of the care partner and also the person with MS to communicate, to talk about the issue of intimacy. So support partners provided hands-on care may feel that they are performing more of a nursing role. Sometimes spouses, girlfriends may feel as if, they are performing caregiver role instead of spouse or a lover role. But communicating, talking about this is the first step to try to finding a place of intimacy between the caregiver and the person with MS. Most of these symptoms can be managed, like I said earlier. We can manage fatigue, we can manage spasticity, we can manage incontinence, but open and honest communication about sexual need is the first step. You have to talk about it. You have to be open about it, and also sometimes we may have to bring in a counselor, a sex therapist to help, both parties, sit down and be able to talk about, the issue of intimacy. But One thing I want us to take away from this slide is communication. Communication is the key. Open, honest communication. And sometimes at my clinic, when I bring up this issue, I can sometimes feel my patients, they don't want to open up about it. And I always ask this at every visit. It's one of the questions I ask my patient, how is your intimacy with your partner? And then, from there, sometimes it takes a little bit while. But after after the first or second visit, they do open up. And then we'll begin to talk about how, we can help, to help bridge the intimacy gap. Next slide. So what are the strategies for effective communication? We'll be talking about communication, and that's what you're going to hear throughout this presentation. So as strategies for effective communication, you have to schedule a regular time for conversation. It can't just happen suddenly. You have to be deliberate. You have to plan it out. You have to schedule, oh, I need to talk to you, babe. Or can we talk this evening? Can I, this evening when we come back home, can we sit down and talk? So it has to be deliberate. 2, sort out your feelings before communicating with your partner. You can't be despondent and try to have a conversation. You can't be angry and try to have a conversation. So you have to sort out your feelings first. You have to take a step back, search yourself, sort out your feeling, then you'll be able to communicate effectively with your partner. Thirdly, discuss concerns and fear openly without embarrassment. You have to be open. And you have to express your fears. You have to express your concern without feeling embarrassed. That means the recipient of that communication also has to be open enough to accept your communication without making you feel embarrassed. Okay, so it goes both ways. Fourthly, work on long-term plans and goals together. Okay, so when I always tell my patient, when they first come in and they get the diagnosis, I always tell them, next time when you are coming, I want you to bring your care partner. So I can sit down and we can talk about the diagnosis. I can answer all their questions. I can tell them what to anticipate the disease progression. Okay, we can talk about DMTs, we can talk about symptom management, and at that point, I can talk about them to anticipate, intimacy issue, conflicts, and we can have all this conversation. So work on long-term plan and goals together. Finally, consult a mental health professional if challenges feels too large. I mean, there are sometimes, it feels as if, we can't handle it by ourselves. And that is when we need to bring a professional, either a counselor, a relationship counselor, or one of our healthcare professional or mental health professional to come in and help us overcome whatever challenges we have. Next slide. So support from family and friends. So like in everything in life, we can't do this alone, okay? Like I work at the VA and I have a lot of veterans. And as veterans, and even I'm a veteran myself, we have that can-do attitude. We have I can do it myself attitude. And I always let my veterans know, nope, this is a time in your life, you need the support of family and friends. So tell family and friends their help is needed and welcome. Keep a list of projects, errands, and services they can help you with. So I always tell my patient, the person with MS people I take care of that, look, I don't want you to completely rely on people, but I want you to find areas where people can come in and help you. We all need help. We all need support. So keep a list of projects and errands and services they can help you with. Finally, give them specific time-limited task. The same thing I said earlier. So you have to figure out, okay, I need help in this area. I can take care of this. I can take care of that. These are the specific area that I need help with. And just give them specific time-limited task. Next slide. Okay, so this right here is, I'm working on like a publication about self-care for Carepartner. So this is the area I'm very passionate about, because I can't tell you how many times the patients I take care of come into my clinic with their care partner, and their care partner breaks down because they are overwhelmed, because they've had enough, because they can't just, cope anymore, and I always tell them that, it's important for the care partner to also take time for themselves. The care partner have to also practice self-care. What is self-care? Self-care is a way to balance activity, preserve longevity and happiness in care, relationship, and career. Okay? It is a collection of habits that can be big or small activity. These are things that you have to do as a care partner to take care of yourself. Try to do something every day that you find enjoyable. Because you are just like a vessel. You can't pour out what you don't have. You can't give what you don't have. If your vessel is full of stress, if your vessel is full of anger, if your vessel is full of despondency, that is all you're going to pour out. But if you fill your vessel, if you take time to step back and replenish yourself, then you can provide better care for your care partner. To be the best care partner, it is essential to take time for yourself and find clarity. The most important relationship is the one you have with yourself. And that is the takeaway I want everybody to take from this slide. That the most important relationship is the one you have with yourself. So you have to take care of yourself. You have to fill your own vessels so that you'll be able to pour out to the person with MS that you are providing care for. Next slide. So we have various types of self-care. We have physical. Physical self-care is physically taking care of yourself, making sure you are healthy, okay? Making sure you are eating right, you are exercising, you are getting enough sleep, okay? We have emotional self-care, making sure you are emotionally tuned, that you are not stressed, that you are not despondent, that you are finding time, to replenish, to have friendship, to go out. When you feel stressed, to find out a way to, to recharge yourself. We have psychological, self-care. And then we have spiritual self-care, which you can get from going to church, from talking to your pastor, from having relationship, family, friends, from meditation. So these are the type of self-care that we can practice, from physical, taking care of physical self, to emotional, taking care of your emotional self, to your psychological self, and overall your spiritual self. So finally, I will cap up this by saying that yes, as care partner and the person with MS, communication is the key, in that relationship, but also for the care partner, themselves, self-care is the key, because you have to take care of yourself. You cannot give what you don't have. You cannot pour out of an empty vessel. So replenish yourself so you can be able to take care, of the persons with MS in your lives.